Hello, I'm Dr. Terry Mason, and I'm joined here today with Ms. Sadia Selvey, who is the VP of Sales and Marketing, and Dr. Lunetta Jackson, a pharmacist, who is going to be talking about the Medicare Part D benefit. And this is really important, so I want you to make sure that you maybe take out a piece of paper and a pen and make some notes, because this is very, very important that you understand this drug benefit. I want to start with Ms. Selvey to talk about Medicare Part D. So you want to tell us about what Medicare Part D is?
Yes, so Medicare Part D is prescription drug coverage. Medicare Part D can be purchased as a standalone, or you can pick up Medicare Part D under a Medicare Advantage plan. So there are two ways to get it: under a Medicare Advantage plan or as a standalone. When I say standalone, it just means you're purchasing a Part D prescription drug plan only. There are other ways that Medicare beneficiaries also receive prescription drug benefits. It could be through retirement benefits, and they have to have credible coverage. It has to be deemed credible coverage with Medicare in order for it to qualify as Part D benefits or prescription drug benefits or credible coverage.
Now, is the prescription or the drug benefit a separate charge, or is that part of, other than with a Medicare Part C plan or Medicare Advantage plan, you'd have to purchase that separately, is that correct?
That's correct, and that's a great point. So Part D is a separate premium. Just like you pay, most Medicare beneficiaries pay a premium for Part B as in boy. They'll also pay a separate premium for Part D if it's a standalone prescription drug plan, or if they purchase it separately from a Medicare Advantage plan. The only time a Medicare beneficiary would not typically pay a premium is if they qualify for extra help or Medicaid, or a low income subsidy is what it's called, or extra help. And in most instances, extra help will pick up the premium or most of the premium based on the level of their income subsidy. And so those are basically the ways that you get Part D, and there is a premium associated with it if you don't qualify for extra help.
Now, Dr. Jackson, you are a pharmacist working in this area.
Yes.
Tell us about some of the issues that you had to deal with in trying to explain, if you had to, Part D benefits to people.
Sure. So Part D for drugs is the benefit that members can have for arresting disease and also controlling conditions. Medications are in different therapeutic classes, and then with CMS, which is Medicare, Medicaid, requires that there's an equal representation of the different therapeutic classes throughout the formulary.
Now tell me, what does that mean when you say different something classes? Say that.
Therapeutic classes. So,
Therapeutic classes.
As we talk about diabetes, that's a diabetes class.
Okay.
For congestive heart failure, you'll have heart failure medications. For blood pressure control, there's hypertensive medications, also diuretics, water pills. Mm-hmm. And one thing for sure we want to have our members take is their cholesterol management, cholesterol medications as well. Also, the plans have different therapeutic classes for in the safety nets. That is the HIV, anti-cancer medications, anti-seizure medications, medications for even transplant, control of transplant conditions.
Now, your job with Zing is to make sure what?
To make sure that our members or beneficiaries receive the medications that are required to help improve their health status and then maintain their outcomes, improve outcomes. So my role is to really monitor with all throughout the company to make certain that member services is informed about the coverage that's required for certain medications. Prescribers are involved and also aware of our prescription, our benefit and our formulary benefit, as well as making certain that the our members have the understanding of how to use their prescription benefit.
Now, when you say the formulary benefit, tell us, what does that mean? Are there drugs that you already have prescribed for different classes, like high blood pressure, cholesterol,
Sure.
and so on?
We look at over 80% of the formularies throughout the Medicare space have certain standard, drug classes to be covered. As we know, as our population ages, we're looking at those types of conditions and making sure that these medications are there to cover the different classes.
So you want to make certain that these beneficiaries have the opportunity to have available to them the best in class for those particular conditions?
That's right. We want to make sure that they have the best quality medications, the ones that actually have proven outcomes, and those outcomes really overall improve the health of our nation, for sure.
Now, what about the education? Because many times people are taking several different medications across
Sure.
different disease categories.
Well, one of the things that we do know that happens is that at the dispensing pharmacy, the pharmacist is actually given education about a medication or prescription. You know that they also receive literature to review. One of the things that we do here at in Medicare and also at Zing Health in the pharmacy department is we look at medication therapy management. And what the medication therapy management is to make certain that the best medications are used for the conditions or the diagnoses that the patients have. Want to look at safety of medications, particular side effects if possible. Want to reduce polypharmacy. If a person is taking 8 or more medications, there's an opportunity for an adverse drug event or even drug interactions. So we want to make certain that every medication that one of our beneficiaries is taking has an actual diagnosis.
This is an important, very important part, because I can see that many of the Medicare beneficiaries are taking multiple drugs. And sometimes, how do you help them keep all of that straight so that they don't take too much of one or not enough of another? Well,
That's being reviewed on a monthly basis. We look at outlier opportunities within reporting for polypharmacy, 8 or more medications. And also going on a processing of the prescription. There's actually a drug utilization review being implemented at the time of point of sale at the pharmacy. So if there's an untoward effect that might happen because the member's profile, has a certain medication there that would react adversely, that's already stopped. But one of the things that medication therapy management also does is talks about side effects and drug-food interactions, if you will, and just what to be cautious about.
Ms. Selvey, Zing is a Medicare Advantage program, which means that the drug benefit is included in that program. Is that correct?
That's correct.
So they don't have to go out and buy a separate supplement to buy their drugs. Now, how do you coordinate that with Dr. Jackson? How does that work in terms of what drugs people can buy or not buy? How does that work?
And so every Part D program, whether it's under a Medicare Advantage plan or if it's a standalone, it has what's called a formulary or a list of covered drugs. And as Dr. Jackson stated, all formularies include every class or therapeutic class of medication. And so Part D prescription drug plans are required to cover at least 2 drugs under every therapeutic class of medication. And so that's the difference when you talk about Medicare Advantage plans or standalone Part D drug plans. They're all going to cover every class of medication, at least 2 drugs. It could be a generic, it could be a brand name, but they're going to be on the formulary. But here's the difference. So one formulary may cover Lipitor, the other formulary may cover, Dr. Jackson,
Crestor.
Crestor. You know, they're both brand name drugs, but one formulary could cover one and the other could cover another. And so the formularies may differ based on the names of the drugs, but all formularies will include at least 2 drugs under that therapeutic class. And so anytime a person enrolls into a standalone prescription drug plan, their prescriptions will be covered. It could be under the generic category or brand name category, but the class of medication will be covered under that formulary, whether it's a standalone or a Medicare Advantage plan. The benefits are coordinated, because you asked how are the benefits coordinated under a Medicare Advantage plan. They're coordinated in the same way because all Medicare Part D drug plans work in the same way. And we'll, talk about that in terms of the 4 stages that all Medicare Part D drug plans have, whether you're under a standalone prescription drug plan or a Medicare Advantage plan. So they're coordinated in the same way.
Okay, just to make sure that our people are clear about what we're talking about, when you're looking at Medicare in a Medicare Advantage program, the Part D is usually included. Is that correct?
In most instances, there are Medicare Advantage plans that do not include prescription drugs.
Okay. Does Zing include prescription drugs?
Yes, all of our Medicare Advantage plans does include prescription drug coverage at no additional cost.
Dr. Jackson, you and both Ms. Selvey mentioned the word generic.
Yes.
Is it true that or not true that they are the same or not the same as the brand name?
So they are the same as the brand name. Generic drugs have to meet the same performance standards and then quality and efficacy standards as the brand name medication. Actually, in our formularies, you find that the quality items for the plan for disease states such as CHF and diabetes are the generic medications actually have a very low copay, and so that is an incentive for the member to really take have the value proposition of having better health, but also saving some money as well.
How do you, other than the financial incentive, how do you convince folk that the generic is as good as the brand? How do you do that?
Well, I think that educate them as we're doing today. But also, if you think about it, and I don't know if you or any one of you all are cooks, but sometimes I'll have to get the generic tomato sauce. But that doesn't mean that my spaghetti isn't any better.
You better talk now.
So we know how to, but these medications again have to pass the same rigorous tests. They're tried and true, and they're evidence-based, and then even with the literature, through the different medical societies and pharmacy societies, and these generic medications have passed it, proven and passed the test of time, and they are the ultimate value related to overall health.
I like to give the example of Tylenol.
Okay.
When you go into a pharmacy and you turn that box around, it says what? Acetaminophen.
Right.
And whether it's Walgreens brand or Tylenol brand, the difference is that Tylenol has been branded. You see the Tylenol on commercials, and it's actually been branded, so it becomes a brand name. And so when you purchase Tylenol over just standard acetaminophen, you're paying for the branding, for the commercials, for them to advertise. That's really the difference between a brand name and a generic. Right. And one of the other differences is that they may have different fillers, but it's the same chemical ingredient for the medication.
That's a very, very important. And for the Zing Part D benefits, how is that different than some of the other plans? And is it better?
Our plan is better because we actually have coordinated care, and we have our care managers, case managers, as well as our physicians who are working very closely with our members to review their medications and then actually give them information about the value of the prescriptions that are they are using. We also work with our prescribers throughout our plan to give them information about outcomes and the types of medications and the different therapeutic classes where we have the best outcomes, just as a reminder for the value.
There are a number of patients who are taking multiple medications.
Yes.
Do we make sure, or how do you make sure that they're taking them at the right time or with the right other medications? Or
Sure.
how does that work?
So with the medication therapy management program, and also back at Zing as well, we look at polypharmacy to see if members are taking 8 or more medications per month. That's one thing that we look at. Then we also have call-outs to our members to do the health risk assessments and look at the types of medications that they're taking. And then not only that, but we also ask about over-the-counter medications, natural medications, herbs, those kinds of other medications that people don't think about maybe, as part of prescription, but all that, goes into health. So we really take a very good look at what the members are taking, because we have reports on a monthly basis as to the utilization and what's happening, and then we're also looking at how we can improve the outcomes for our members. So we talk about diabetes a lot here, and we're looking to really improve statin use or cholesterol management use in our diabetics. Medicare actually, set some of these standards for us, so I think it makes it pretty, pretty easy for us. We just have to work with our patients to let them understand that this is for their best possible outcome, but also Zing Health as a plan is measured on how we improve the health of our members.
Now, do the members ever give you feedback? They gave me this prescription, and I took this medicine. Maybe I took it with this or took it with that, and I got dizzy, or do you get that sort of feedback?
We get that feedback. And then we go and obviously look at the member's profile, and we will work with the member's prescriber. And that's another thing too, making certain that the member has, the necessary prescribers and they're not doctor shopping, and another thing that they're not pharmacy shopping. And so once you get a member, within the network of the physicians, within Zing Health, and also actually going to their same pharmacy so they can have a relationship with the pharmacist, and then we help them. We're able to assist the members, with this information, also through our care management area. We look at hospitalizations, ER visits, and where there might be outliers where we can actually improve care and costs.
Do you get an opportunity, or do we make an opportunity to sort of, I don't say necessarily sit down, particularly in this time, but to go over the medications so that the members know what medicine they're taking for what reason?
Yes, with the MTM, with medication therapy management, again, each medication, and that is an opportunity for a pharmacist or actual licensed professional to review the medications with the member, and this is all done in person or telephonic. And then with each medication should have a diagnosis or a condition matched to it. And then there's what we call it interviewing to help the member elicit any other medications that they might be using that they might not think about, but really help them be really aware about medications, looking at even vitamins if that's the case, not taking too much of a fat soluble vitamin, or vitamin drug interactions that could be a potential, but looking at the conditions, the diagnoses, and then the medications that the members are taking. And then we are looking also at the outcomes. Is the blood pressure in control? Is the cholesterol going down? Is the hemoglobin A1C, moderating and lowering?
So you're working then with the care team?
Yes, with the care team, yes.
So you're getting data from the care team in terms of what the hemoglobin A1C, which is a blood test that lets you know not what your blood sugar was today, but what it's been for probably a few days.
The last 90 days, yes.
Last 90 days to be certain that it's under control.
Right.
So you get a chance to interact, and how does that interaction take place?
We interact. Right now, we're doing it via Zoom call or Microsoft Teams, if that's the case. But even via email and then instant messaging. So we have regular meetings, and then a couple of times a week that we actually have episodes, and then we actually have a morning huddle every morning to look at any other care concerns that might have come out that we all need to pay attention to.
Ms. Selvey, you were about to talk about these 4 drug stages. Could you elaborate what that means?
Yes, so under Medicare Part D prescription drug plans, whether you join a standalone prescription drug plan or if you receive Part D through a Medicare Advantage plan, all prescription drug plans work the same way. And so Dr. Jackson talked about every prescription drug plan having a formulary or list of covered medications. And then they actually have 4 stages for the Part D plan. The first stage is a deductible stage. And so when you join a Part D prescription drug plan, your plan could have a deductible or no deductible. And so a deductible is what you have to pay first before your plan will kick in and start to pick up some of the cost of your medications. And so if you join a plan with a $400 deductible, you'll have to spend $400 out of your own pocket first in order for your prescription coverage to kick in. Under Zing Health, our prescription Part D drug plans have no deductibles. And so under a Zing Health plan, you automatically enter into stage 2, which is the initial coverage stage. Every year, Medicare provides an amount of drug coverage for each Medicare beneficiary under Part D. And so once a person meets that initial coverage, and how they meet it is they'll go to the pharmacy and their plan will pay a certain portion, and then they'll pay a certain portion in terms of a copay or a coinsurance. Once that cost of what they pay out of pocket and what their plan pays out of pocket reaches the initial coverage limit, they enter into the 3rd stage, which is the coverage gap. Most people know the coverage gap as the donut hole. The donut hole is where your coverage is reduced drastically if you do not qualify for things like extra help, or we'll talk about that. But during the coverage gap stage, you'll naturally spend more money out of pocket. And this year during the coverage gap, whether it's a generic or a brand name, you'll pay 25% of the cost of your medications. And so if you were, let's say for instance, on a generic drug, and let's say your benefit under your plan was a 0 copay, once you enter into the coverage gap, you'll have a 25% coinsurance. And so sometimes we'll get a call and say, hey, I was paying the 0 copay and now I went to the pharmacy and they're trying to charge $15. I don't understand what's going on. 9 times out of 10, they've met or entered into the coverage gap or the donut hole where they now have to pay a certain percentage of their medications. Once they meet a certain amount of money, and it would have been good to have the different phases in terms of costs up so our viewers can understand what type of out-of-pocket costs that they would have under Part D. Once they meet a certain amount of money in terms of the coverage gap, and right now it's literally over $5,000 in prescription drug costs, they enter into the next phase, or phase 4, which is called catastrophic coverage, where the plan will kick back in and pay 95% of the cost of their medication, and they'll have a 5% coinsurance or a fixed amount, whichever is greater. And so that's the way that Part D prescription drug plans work, regardless to if you join a standalone prescription drug plan or a prescription drug plan under a Medicare Advantage plan.
This almost requires another little graphic or something to
say definitely.
What this is, because
yes.
I was just trying to follow it.
It's good to have a graph or just a picture of what that entails.
Mm-hmm. Well, you can, if you need more information, you can always call 1-866-946-4458 to get more information. This is something, again, that I've had some personal experience with, not myself, but one of my family members, because they're taking one of these new drugs for his asthma. I don't know if I should say the name of the drug, but it's one of those eosinophilic things, Nugala, one of those drugs. Mm-hmm. And it's like $4,000 for the drug. How does this benefit in Zing? I don't know if you've used or had anybody on those drugs, but how does that work?
So what they actually have a certain copay that they pay up to the coverage gap into the catastrophic. So what we do try to do as well is place these types of medications on specific tiers so that there's not untoward or a burden, such a financial burden on the patient, the member. So we look at that. We look at all the different specialty drugs, and then we try to get the best, possible price for that. But also how we can have an equal share, that's based on the member's income level. I think, based on their income level, they have a lower copay, if you will, for the particular medication, even within the specialty realm. So, like Nucala, that would be one that would be, especially if it's a low-income patient or member, they would have a very low, copay on that.
And because that could be the difference between taking the medicine and not taking it, even when you need it.
Sure.
And do you work with what are called pharmacy benefit managers as well?
Yes,
How
we
does that
do.
work?
Yeah, so the pharmacy benefits managers actually help us, with setting up the formulary and operating that and providing the information, even the explanation of benefits for the member. Every month, a member gets an explanation of benefits of all of the services that they've used, for the previous month, and then also it's accumulating over, as the months go on, because the benefit starts at the beginning of the year and then towards the end of the year.
There are a number of co-payments. So how is the Zing pharmacy benefit structured? I know you talked just a bit about it just now, in terms of the co-payments and exceptions and any savings models or any programs for people, particularly those, because nowadays a number of drugs, I didn't mean to just single out that one particular one, but there are a number of drugs that are very expensive.
But it's important to note, you brought up an excellent point. Sometimes Medicare beneficiaries can talk to their doctor because there are manufacturer discounts or manufacturer programs where if a member has to take an expensive, very expensive drug, sometimes they'll have programs through the manufacturer that member may qualify for to reduce their out-of-pocket costs for that medication. And so in your brother's case, he may be also getting assistance from the manufacturer through a program because those type of drugs will eat up their initial drug coverage and they'll enter into the coverage gap very early on in the year because of costs, such as that.
Sure. Yeah, I mean, the pharmacy piece is important because it's a recurring cost.
Yes.
And it's very, very important to know this. So do you, as the keeper of the formulary, work with the doctors in the network to say, hey, this is the Zing formulary, or how does that work?
Well, the Zing formulary is on the website as well. Any physician that's e-prescribing can actually download our formulary and actually have all of the coverage determination information right within their device, if it's their phone or their tablet or their computer. And that information, actually, if there was a medication that was prescribed that's not on formulary, the Zing formulary will be notified of actually giving the doctor or the prescriber the actual medications that are covered within that class of medications.
Sure. So do you then correspond with the doctor, let them know?
Yes.
That's what's happening?
Yeah, that actually comes via, via the computer. That information is sent right back to the doctor.
So the co-payments and everything are managed through?
The co-payments are managed through the whole benefit of the whole plan, of the medication co-payments, as well as all of the other office visits are all managed. But one of the opportunities that the prescriber has, and if there's if a member is having trouble with medications, in addition to the special savings plans that they have, prescriber can actually submit a request for medication, for a member, to request a lower copay for that particular member, because there's obviously a need for the medication. The member cannot pay for the medication, but the prescriber knowing and can provide information related to why the member needs this particular medication, and then why they need to pay at this lower copay. So that is actually a coverage. It's called a coverage determination, and that can it can be submitted and reviewed.
Ms. Selvey, how does this coordination of these kinds of benefits work with one of the special needs programs, like the chronic disease special needs program?
I mean, it works in the same way that you just described. Mm-hmm.
So no matter what program across Zing, this sort of coordination works with all of the membership. Would that be a fair statement?
That's right. Mm-hmm. Mm-hmm.
And because I think that's really so important, that there's somebody looking over everybody to do two things: making sure they're getting the best drug for the best cost for the patient.
Right.
So that's amazing. Now, do you have huddles with the docs, or are these just electronic meetings, or you go over the formularies? How does that work?
We have huddles, and we're looking to get out and really work with our prescriber groups to give them the information, about how Medicare works. It is quite, can be a little bit confusing at times, but also, letting the doctor know that we have the best interest of his patient or her patient, at heart, and then we're also trying to, improve the health status, of all of our members. So we can work with them if it's a specific, condition or a set of conditions, and actually get their feedback as to, what works best, and and related to the evidence, what works best. And then we take that in consideration even as we plan for the next year. I think that one thing that's to be noted is that we are actually working for 2022 benefits right now in March. But we look at this, and we look at take a retrospective look of all of our performance, the different classes, where the opportunities are, where we can provide more services, and if there's other conditions that really we see that are coming out, and we need to be able to provide more choice within a specific class. It's a feedback loop that we work from, and we're constantly providing reports about utilization, adherence. And then, of course, with new therapies, even like now with, in COVID time and the new vaccines that are out, we right away are very in tune to what CMS is covering, and then they are actually very active in, providing information on late-breaking, developments. So.
Now that sounds like there's great coordination, and we really want to make certain that this coordination is not just about cost. It's about making sure you get the best quality for the dollar that you are spending. Would that be a fair characterization?
Absolutely. And as Dr. Jackson stated, there is medication management and medication management of the utilization. And so some medications may require a prior authorization where the doctor has to authorize that medication, or it has to be approved. Certain medications require step therapy, where the plan may require you to try other drugs prior to a drug being prescribed by your prescriber if you have not tried those medications. And sometimes it also requires for you a quality analysis of that particular drug. Certain drugs, such as narcotics, can have quantity limits. And so there are different ways to manage the drugs based on the drug interaction, based on the type of drug. So that's, again, how plans coordinate and manage drugs under the plan. So it's a number of, and I would really like for Dr. Jackson to talk about the formulary exception as well, because sometimes when Medicare beneficiaries transition to a plan, their drug may not be covered on the formulary. but there's, ways that they can get it covered through transition of care or through a formulary exception. And I think that's important to note as well.
Right. So if a new member started our plan, they actually receive what is called a transition fill. So if they were on a medication that is non-formulary on Zing, we do not, disrupt their care. We actually, provide that medication for them, the non-formulary medication for the member, and then also reach out to the member in writing and also via phone to let them know that this medication is not covered under our plan, but we're doing this as a courtesy. And if you need to have the medication, you need to do provide a prior authorization or coverage determination and then that helps the physician know that here are alternatives that are available for this particular medication. But if your member or your patient has to have drug A with evidence, that medication will be covered. And another, I think I talked about the coverage, the formulary, the copay as well. If a member cannot, for some reason, pay for a medication or they can't afford a copay, their prescriber can also provide coverage determination request for a lowered copay.
This is great information, and we always want to make sure that people go to the website, myzinghealth.com, so they can see even more information about this. And also, if they're interested, it's always good to get a call, to have a call. If you're thinking about making a change now or when that appropriate time comes for you, just give us the call at 866-946-4458. Because I think it's important that you plan, that you don't just wait to the last minute. But you plan, because going through that takes a little while to make certain that Zing wants to be sure that they're the right plan for you, and you want to make sure that you're the right person for Zing. The issue about the medications, is there a mail order situation, or
Sure.
do you use the pharmacies?
Sure, there's mail order is really a great way for our members to receive their medications without interruptions, and especially in these times, and with the pandemic as well as this weather in our part of the country. It's more convenient for the patient, the member, and also it improves adherence. I mean, that's one of the things that Medicare looks at us, is how well are our people taking their medications, and then how are the outcomes becoming, improving on these medications.
There are so many. I mean, this is such an enriching conversation about the whole plan, and all the things that are happening sort of behind the scenes to ensure quality, to ensure that the member is getting the right drugs that they should be getting, and then make an opportunity for drugs that may not be on formulary to become to be able to still be dispensed.
That's right.
As those difficulties may be worked out.
As we work through that, yes.
Yeah, I think it's so important, just so important. I just really want to say that this is the Part D benefit of Zing Health.
Yes.
Is that right?
Yes.
So but Zing, since it is a Medicare Advantage plan, you don't have to sign up for the Part D.
Right.
Is that once you sign up for Zing,
You
then that
automatically get it.
is that? I just want to make sure I'm characterizing that
Yes,
correctly.
yes, you automatically receive Part D as a result. And then there are other really good things to know about any Part D plan that you enroll into, and we'll talk specifically about Zing. But also be aware that your Part D plan will cover certain pharmacies. Pharmacies are considered preferred or standard. And it's always important to know if there are preferred pharmacies under your plan. Preferred pharmacies means that you will get your medication or prescription at a reduced cost if you utilize a preferred pharmacy over a standard pharmacy. And so that's important to know for any Part D plan, because most plans do have a preferred pharmacy versus a standard pharmacy. So you're able to go to any pharmacy, but when you go to the preferred pharmacy, your costs are lower than what you would get at a standard pharmacy.
No, I think that's important for people to know because particularly nowadays, the pharmacies are pretty much all over the place, and you can find one relatively.
And we actually
easily.
cover, I mean, have every one of the major, chains within our network, and then even some of the other, clinic type pharmacies as well. We have, I think, more than 4,000.
Mom and pop pharmacies.
Every type of
Right.
pharmacy, we have those in our network because we want to make certain that the neighborhood, is enriched. I think because the pharmacy is a great place for education. The pharmacists are always available to, assist if it's something, as simple as a cold, or even we have a OTC benefit, right? That is not outside of the formulary.
OTC.
Over the counter.
Okay.
Over the counter. So over the counter benefit where, a member could get their Tylenol or their blood pressure cuff or a thermometer, things that you would normally pick up, at the front part of the pharmacy, but that benefit is provided to our Zing members as well.
So this seems rather, or not seems, but it is very comprehensive in terms of its scope, in terms of how it's monitored, and in terms of the variety of places that people can avail themselves of their medications, and the flexibility that if you were on medications before that you still need, there is an opportunity for that to continue with the guidance and the counsel of people from your staff.
Exactly right, yes.
That's great, and I think that people should avail themselves of that. The other part that we have to speak just a bit about is, what if a person has some questions about their medication? Or do you take a look at people that are taking multiple medications to determine whether or not there's potential drug interactions that could be problematic?
Sure. We do look at particular therapeutic classes that we actually recognize that there could be drug interactions, or very significant drug interactions. I think antibiotics is a good example because they're episodic. They don't last always, but they can interact. So we look at those types of those types of interactions. We actually review almost on a daily basis, those types of, interactions or rejections, and the reasons, why that is the case. Then we have a roll-up, of that on a pretty much a monthly basis as to what are the outliers and what's happening. We do look with care coordination and care managers, along with myself and the other pharmacists at the plan. We actually look at the therapeutic, adventures, of our patients, and then where the opportunities are to improve care. We see, drugs that are, there are many drugs that are, with very low doses, and we look at where we can consolidate medications, reduce the, pill burden, if you will, on the member, but also improve, adherence and compliance by, if they don't have to they can take 3 medications instead of 8 because there's a combination, hypertensive med, it's once a day, that kind of a thing. We look at how we can make the medication use process, better and more efficient, for the member. We also look at, if that's the case, we need to do punch cards. We can do that as well.
Punch
cards. So that is like on the calendar. So if a member is having a problem remembering the medications, you can put the morning dose, the afternoon dose, and the evening dose, in specific packets by the calendar.
That reminds me of something. And this is, I guess, maybe a little, I'm going to ask the question anyway, because I know it may be difficult to follow non-prescription medication.
Sure.
But is there any way, because I know we do a lot of laxative abuse in our,
yes.
Well, I'm just,
that's a real life.
It's a real issue, and sometimes they may want something stronger for this. How is there a way to sort of pick up those sorts of things?
Sure, with care coordination and then of course health risk assessments, we look at those types of daily or functions of our day, our daily lives, throughout our daily lives. That type of information is gathered. Do you have any, how long do you sleep? What is your sleep pattern? What do you, what are the foods that you eat? Are you drinking enough water? I mean, we really provide education related to best health. We know if we're managing cholesterol and diabetes, we want you to eat fruits and vegetables, and then also as much water and fluids as possible. So that that information is also fed into healthy living and outcomes. Is fed in as well.
Yeah, I mentioned that, and I didn't mean to try to make light of it, because I've seen many people go in and buying bottles of some stuff. I don't want to put the name up what it is, but they're also buying things in pill form, and they're buying all kinds of things. And I often wonder, they could be having a tumor or something that's not properly diagnosed.
Well, clearly when they, once we have done those HR health risk assessments, we actually, follow up, based on the level that, the degree of difficulties or the issues that the, member is having. We will follow up on a periodic basis to make certain that these conditions are being improved. If it's something that really they might need to see a doctor, that, is being looked at, and also we actually help them, have appointments to the types of specialists or the physicians that they need.
When you get their medications, do you just get the ones that they're prescribed, or do you get stuff that they're buying over the counter, like laxatives or acetaminophen?
Right now, we only get what's prescribed, but we do take note and have within their, record the over-the-counter medications that they do take. We do know, and I think you talk about stimulant laxatives. It's we know the lack of it might be medications that they're using that cause them to have this feeling that they they can't make it move, but also to providing the safety aspects of it, drinking that 8 glasses of water a day, having. Making certain that you're not taking medications that really dry you up. Sometimes people have allergies, and then they're taking an antihistamine and it dries them up. And so, but there's another alternative, which is actually more evidence-based and, inhaled, corticosteroid if that's the case. But something to really improve and tailor for the best possible use for the patient.
Well, it sounds like the Part D part of that is managed by Zing does an amazing job of making sure that what the people are taking by either what they have prescribed or maybe even what they're buying over the counter. And I just want to say this is an amazing situation to be able to hear that a company is doing this kind of work.
And
for the safety.
Another amazing thing about our Part D program under Zing Health is all of our plans that offer Part D. Well, first of all of our plans have Part D, but under all of our plans with Part D, you also get enhanced prescription drug coverage. And what do I mean by enhanced? So during the coverage gap or the donut hole that we talked about earlier, where this year, if someone enters into the coverage gap, meaning that they've used up the money that Medicare made available in their initial coverage phase, once all of that money is used, because they're going to the pharmacy and they're paying a copay and their plan is paying a portion, once that is used, they enter into the coverage gap or the donut hole, where they're paying 25% of the cost of their medications. Under all Zing plans, we have enhanced prescription drug coverage, where when you fall into the coverage gap, you continue to pay the same copay for certain tiers of medication, whether it be tier 1, tier 2, and these are generics, or tier 6, because under tier 6, that's our select care tier, where all of the maintenance drugs under that particular tier are covered at no cost. And so
what kind of drugs would those be?
This would be maintenance medications for things like diabetes, high blood pressure, cholesterol medications, different maintenance medications, medications that are considered maintenance medications, or medications that a person will be on basically for the rest of their lives. We have a specific or select tier for those medications where our members receive those medications at no cost, even when they fall into the coverage gap. So that is definitely worth noting, because there are a lot of people or Medicare beneficiaries who don't qualify for extra help. And extra help is a program that people can qualify for through Social Security. It is income based. And if they qualify, Social Security will help pay the cost of their prescription costs, such as their premiums. It'll assist with co-pays, where you'll have a fixed co-pay amount, and it won't be according to the plan, it'll be according to your subsidy or your income level. So those types of programs are extremely important. To see if you qualify for those programs, you can contact Social Security. You can go on socialsecurity.gov to fill out the application or call directly. But those are very, very, very important programs, and anyone that is viewing this particular segment should actually see if they qualify, because it is based on income, and it will reduce your prescription drug coverage drastically in terms of out-of-pocket costs.
This has been an amazing discussion around the pharmacy benefit. I think is great. I think that it gave us an opportunity to let people know what the real difference is and the value proposition. In other words, why it makes sense to strongly consider the change to Zing when that time comes, and looking at these different programs. And I want to thank both of you for an absolutely fantastic job, as usual. And Dr. Jackson, just really hearing about the care and the thought behind really sort of reinforces the idea that Zing Health is really focused on trying to get the best outcome for the patient.
Absolutely.
And looking at anything that can be done to defray cost where that's necessary, to defer substitutions of medications that might be the best for that patient. So I think it's really, really great. And I want to thank both of you.
And we thank you.
I think it was time well spent. And I want to thank you, our audience that is listening to this. And always, our number is 866-946-4458, or you can go to myzing, that's Z-I-N-G, health.com. Thank you so much for watching this. Thank you so much, ladies, for being here.
Thank you.
And thank you for tuning in and watching. And we hope that this has been as helpful to you as it has been to us to give it to you.